Qualified, professional, and compassionate doctors talking real solutions to real health problems.
From the time the coronavirus hit the world, it quickly became a pandemic, or that means a worldwide infection. However, parallel to this, we have seen a surge of information, which is what we call an infodemic. So with me in studio to discuss the myths and facts around the coronavirus, I am pleased to host two powerful doctors who are leading the medical fight against the coronavirus. On my immediate right is Professor Byachika Pauline Chibuika, the head of department of the Makerere University Department of Medicine and the past vice president of the Association of Physicians of Uganda. You're most welcome, Professor.
You. Thank you, Dr.
And on my left is Dr. Christine Sekaja, a physician with Mulago Hospital and the Vice President of the Association of Physicians of Uganda. You're most welcome, Dr. Christine.
Thank you very much.
Yes, so we're pleased to host both of you on the show. I am yours, Dr. Dara Sawachi. So let's quickly just dive into and focus on the myths and misconceptions surrounding the coronavirus. It is now the talk of town, and obviously there are lots of information out there. Some are true, some are not true. So I want to tell which is which. For example, does drinking alcohol kill the coronavirus in your body? Fact or fiction? Well, our experts will tell us. Maybe I'll start with you, Dr. Christine.
So alcohol, that's fiction.
Fiction?
Yes,
okay,
that's a
so
myth.
Not true.
Not true. So drinking alcohol does not kill the coronavirus in your body. Alcohol is useful to disinfect surfaces, to disinfect your hands. It's usually put in sanitizers, and we usually want it at a concentration of about 60% alcohol. So it's used exteriorly and not interiorly. If you drink sanitizer, it's more likely to cause more harm than good.
Yeah, but some people are interested. They'll argue that the alcohol like in a bottle of gin, is 40%, and is very close to the 60%. So can't that work, Professor? What do you think?
Alcohol in a bottle of gin. Mm-hmm. So we all know the dangers of alcohol. If you take too much alcohol, especially that kind of alcohol with high concentration, it has various effects on the body, bad effects, especially the liver. So it will just instead destroy your body organs, especially the liver. But instead, we prefer that, we recommend that alcohol in the concentration that Dr. Sekaja has just talked about is used as disinfectant, because it actually penetrates into the envelope of the virus to destroy the protein coating of the virus, okay, and hence destroys the virus. So but when you drink it, it's not going to have effect on the virus, because the virus is inside the cell. Inside the cell? Yes. But the alcohol is... The alcohol is in the GIT, the gastrointestinal tract. Okay. Yes, it will get absorbed into the digestive system. It will get absorbed into the blood circulation, but it will not have direct penetration and direct effect on the virus. Okay. Well, explained by the experts, drinking alcohol, whether it is 40% or wine or beer, will not kill the virus. If you have the virus in your body, you must seek medical help immediately. But so what do you think about the president of a famous country who said injecting disinfectant will kill the virus?
It's more likely to kill the person being injected than to kill the virus, and that would kill you very fast. But how so? Because
the principle is in disinfectants like alcohol will kill the virus. So the reasoning was if you drink, if you inject, it will kill it.
So remember, the alcohol that we're using as disinfectants is actually toxic internally to the body. So it's actually more likely to kill your body cells and cause damage internally than it will kill the virus. So these are alcohol content. These sanitizers are supposed to be used topically. That means on the skin, externally, and not taken internally.
Oh, wow. Okay. So alcohol take note, is only for external use in the setting of hand sanitizer. If you drink it, oh, that's now serves another purpose. But moving on, Professor, what other myths have you had in your career? I think you've interacted a lot with patients, and they have all sorts of stories.
Yes, I've had patients talking about drinking salty water and
Okay.
this reducing their risk of getting coronavirus.
Like the normal saline of hospitals?
Yes, like the normal saline in the hospital, or simply a home remedy, a mixture of salt and water at home to kill the coronavirus.
And
That
does
is
it
a myth.
kill? That's a myth.
Yes, that is
Okay.
a myth.
I don't know, why would people think salty water kills the virus?
I think they think salty water would kill the virus because of the fact that salt has traditionally been used for preservation of food. Okay. You know that when you use salt, many people have used salt in the past and probably even to the present to preserve certain types of food, to prevent it from getting spoiled or getting actually getting contaminated by bacteria. I think that's where the myth
Maybe
comes from.
that's where the principle. So because some people I think use salt water to wash like vegetables, raw vegetables. So maybe they think the coronavirus will also die. Okay, so how
I think
about
I've
you,
heard
Dr.
of
Christie?
people actually putting salty water in their noses, and there was something going around on social media saying if you wash your nose several times in a day with salty water, you're less likely to get coronavirus. And I think
Isn't
based on...
that a painful experience?
It must be, because try it. If you try it, I think if you try even just normal saline and taking it in, it has a burning effect through you. It's very corrosive. So I think that is probably the principle. People feel like if you feel that burning sensation, it's actually killing something. But it's actually corroding the skin and can cause more harm. It may be used there are some drops, nasal drops that are used for decongesting the nose when you put it in your nose. But then it does not kill the virus. It definitely does not kill the virus. It might just make you feel a bit more comfortable for a while because it decongests your nose, but it will not kill any virus in there.
It actually helps to make the mucus to loosen, to make it thin so that you can actually get it out of the nose,
And
but it
sneeze.
won't actually kill the virus.
Yeah.
Yes.
So people who have flu, they're okay to use salty water?
Well, if you have a flu and a blocked nose, there are normal saline drops that you could probably drop in your nose and will lighten the mucus in your nose, and then it will allow it to flow out easily. I think people frequently use it for children who are not able to sneeze. Yeah.
Oh, very interesting. That's why we're here with the scientists, the experts in the field, to tell us more about which myth is myth and which is the fact. So I think moving on, how about people who go to the gym, you know? There are those who go to the gym, they go to the sauna and the place is all steamy. Is it the sauna or steam? I don't know which is which. Sauna is the dry one.
The dry, then steam
there's
bath,
the
yes.
steam.
the steam
Yes, so
bath.
the steam bath and then the sauna. Are those effective against corona, Professor?
The sauna and
the
steam
steam
bath.
baths, yes, like in the gym.
Like in the gym. No, you know, gym is different from sauna and steam bath.
Oh, okay, but
Yes.
I see most gyms have sauna and steam and then gym.
So really,
most
when you
people
go
would think
into
when
the
they're going to
sauna, the sauna is dry heat. So you sit in a small room, enclosed room with heat, and it makes you sweat. So basically, it gets your body to produce fluid through the skin. So your question
will that heat, when people breathe in that heat, will it burn the virus and get rid of it in the lungs?
No, that's a myth. It will not burn the virus.
Or the steam. You know, when people fall sick, there was that theory that, I don't know if it's true, but when someone has, for example, has flu, and then they will get a hot cup of water, which has steam, and try to inhale the steam.
So what the steam does, inhaling that steam, it's basically helping you to decongest your respiratory system. The breathing system,
Okay.
yes. It will help you to make, if there's any mucus inside there, it will make it less tenacious, to make it loose so that it can flow out easily. If there's congestion
kind of like
in your...
unblock
Yes, to unblock your nose,
but
yes.
not to remove the virus.
Not to remove the virus.
Wow, very interesting. So alcohol, steaming, and disinfectant, when used correctly, can kill the virus. That is only for topical, on the skin of the body. However, drinking alcohol will not remove coronavirus. Likewise, breathing in steam or dry air will not kill the coronavirus. So more about these myths coming right after the break. Don't go away. If you have any questions regarding corona and the myths surrounding it, just forward it to our social media platforms. We will answer each and every one of them. So don't go away. We'll be right back.
You are watching the Doctalk Show.